We've done our talk on whether the Slip Slop Slap campaign has had a positive impact on public health. Over this side, we've got the against, and over there is the for.
We are all aware of the correlation between UV radiation and skin cancer. The Slip Slop campaign has led to an educated population and an increase in the overall awareness of sun protection and the damage that comes to an individual's health that comes from the sun. The Slip Slop campaign has significantly increased the knowledge of Victorians when it comes to sun protection, as it magnifies that skin cancer is highly preventable through the simple yet catchy message. People all over Victoria are educated to slip on a shirt, slop on the 30% sunscreen, and slap on a hat. Through the increased education on how to protect oneself from the sun, the campaign has had great results. The campaign has prevented more than 103,000 skin cancers in Victoria between 1988 and 2003, resulting in more than 1,000 deaths being averted. Through this significant decrease, it is clear that the campaign has had a positive impact on public health, and people are continuing to learn new ways to protect themselves, to which has led to a further decrease in deaths from the sun's rays. Not only has the campaign led to an educated population, but through the Slip Slop Slap campaign, there has been an immense attitude change towards the sun. Since the launch of the campaign, the proportion of Victorians wanting to get a suntan has decreased significantly from 61% in 1988 to 35% in 1998. In addition, those who felt more healthier with a tan fell from 51% to 21%. Furthermore, those who thought that it would be easier to enjoy summer with a tan dropped from 62% to 29%. This just goes to show that individuals are making healthy life choices for long-term benefits through the promotion of the Slip Slop ad campaign and an overall decrease in the need to use to tan.
Despite efforts to educate children and policy focusing on Slip Slop Slap messages in schools throughout Australia, adolescents and young adults are choosing not to follow this message outside the schoolyard. Melanoma is the most common cancer in young Australians, yet so many young people are not taking precautionary measures during the summer months. An article by McInerney in 2008 discussed results from the 06-07 Sun Protection Survey, which found that 1 in 4 teenagers get burned on weekends, and only 4% of 12 to 17-year-olds wore wide-brimmed hats. This is significant when compared to the adult averages of 14% getting sunburnt and 24% wearing wide-brimmed hats. Individuals who work outdoors are also much more likely to develop skin cancer due to greater UV exposure from spending their working day out in the sun with little or no respite. Despite regulations and recommendations, many outdoor workers aren't meeting the guidelines for exposure. A report from the Australian Radiation Protection and Nuclear Safety Agency in 2006 found that 94.7% of outdoor workers exceeded the 8-hour exposure limit, while another 2.8% had received more than 2/3 of the amount within a 4-hour period, indicating that they were likely to exceed the maximum limit over an 8-hour working day. Employers found the biggest issue with the Sun Smart practice was the lack of desire from staff to comply with changes in clothing and workplace procedures. Until the Slip Slop Slap campaign does more work to specifically educate population groups that are most at risk due to their behaviours, and the numbers start to change, it surely cannot be considered an effective campaign. On the other side of the coin, there have been negative impacts on the community due to those that take the Slip Slop Slap campaign too literally and barely get any sun at all. Vitamin D is important in the body as it assists in the absorption of calcium, a mineral that plays a large role particularly in bone health. Only 10% of the body's required vitamin D intake comes from food, which means the rest must come from the sun exposure. The encouragement of this campaign to avoid the sun's direct glare is becoming a problem for those that religiously follow its guidelines by not allowing them to be exposed to enough sun to meet their requirements. By limiting exposure, people can be unknowingly placing themselves at risk at poor health when they think they are doing the right thing by staying out of the sun. Low levels of calcium of vitamin D don't display many symptoms. However, effects can include bone and muscle pain and result in low bone mineral density due to the lower levels of calcium in the blood. This is cause for concern, particularly in children, as they are still growing and developing bone mineral density. The lack of vitamin D can ultimately result in a bone deformity called rickets or osteomalacia, which is the softening of bone in adulthood. The Slip Slop Slap campaign is lacking in this area and needs to address that some exposure is good for health.
The Slip Slop Slap campaign was one of the first major public health campaigns promoting ways to avoid the dangers of sun damage and furthermore skin cancer. Having since been adapted to Slip, Slop, Slap, Seek and Slide, this set the groundwork for numerous other skin cancer interventions, such as the SunSmart campaign. Even the word SunSmart itself has become synonymous with Australians, embedded into everyone's vocabulary. Using a hat, sun cream, glasses and protective clothing are all elements that make a person SunSmart, all related through one word. Even if some people aren't necessarily SunSmart themselves, they know exactly what it means to be as such. This itself shows the impact that Slip Slop Slap has had on the public. But looking deeper than just vocabulary, the SunSmart campaign has impacted and changed numerous sectors of the public landscape. In 1998, 52% of local governmental authorities reported having the sun protection policies in their municipal health plan. In 1990, this figure was only at 29%. We are now in 2014, and the amount of expansion in this area since then is potentially huge. There has also been a particular focus on primary schools, where significant change has also been seen. The Cancer Council has been working closely with primary schools to make them accredited SunSmart schools. In December of 2000, 71% of all primary schools were accredited as SunSmart schools. This means they adopt a sun protection policy that includes compulsory hat wearing, as well as structural and infrastructure changes, including protection measures built into the curriculum, as well as built shaded areas. There is a huge benefit to public health in making a particular effort at the primary school level. Firstly, because children are being protected from the sun when they're most active and most vulnerable, but second, they're also instilling behaviours of safe practice in the sun from a very young age. The negative speaker, however, made some interesting points about a particular group, adolescents. Adolescents or youths stand as a quarter of adolescents and youths stand for over 25% of sunburn victims over a weekend period and hold only a meagre 4% wearing a wide-brimmed hat as some form of protection. They use this as a means to point out how the Slip Slop Slap campaign as a whole is having little impact on public health. Taking a broader look into this, a study found in the Cancer Council of New South Wales showed that adolescents between 12 and 18 showed a decreased use of sun protection. However, the study also reported that there is an extremely high number of adolescents still recall the main message from the campaign, this being the Slip Slop Slap initiative and even the messages and jingles from it. This would suggest that teenagers are just being teenagers, abrasive to a behaviour change. It's seemingly unfashionable to wear a hat and therefore make a change, and vanity is surely overriding safety when it comes to getting a tan. To outline but one faction of the Slip Slop Slap campaign would be remiss. The goal of the Slip Slop Slap campaign was firstly to decrease the incidence and mortality of cancer. The hard facts of the matter show that 25% of 100,000 people in 1996 were diagnosed with some form of skin cancer. That has changed in 2010 from 14% in every 100,000. As well as this, there's a showed decline in the most common form of skin cancer, sarcomas, that have been diagnosed to people under the age of 45. Admittedly, more work can be done to try and change the behaviours of adolescents, but across the board, the initiative has aided public health enormously. Without the Slip Slop Slap campaign, there would be no SunSmart campaigns and those like it, no trailblazing initiatives to grasp the public's attention. And without these, there would be an even more alarming rate of skin cancer incidence and mortality in Australia. To conclude, we are certain that the Slip Slop Slap campaign has had a positive impact on public health through not only the increased education of the public on the dangers the sun has, cancer and its potential preventative measures, the change in perception of thinking tans and other sun-related incidences are healthy, and also the vast structural and policy change in a number of areas that the campaign has facilitated.
The general population is unaware of many of the health risks associated with long-term UV exposure. The problem is that the Slip Slop Slap campaign hasn't really identified key target groups or created a focus for the more vulnerable individuals in our society. According to the Cancer Council website, 2 in 3 Australians will be diagnosed with skin cancer before the age of 70, which isn't an overly impressive number for a campaign that's been running for over 30 years. The number of people who choose to tan in the sun may have decreased. However, many people are looking to solariums in an attempt to have a healthy brown look. A study conducted by Gordon et al. Amongst Queensland office workers found people were looking to sunbeds in order to gain a tan. 58% of these solarium users reported burnt skin after using the indoor sunbeds. It was also established that the strongest indicator for using indoor tanning facilities was the individual's belief that it was a safer alternative to sun exposure. This has been proven not to be true, most notably in the case of Claire Oliver. Claire passed away in 2007 due to a combination of sun exposure and, in the most part, solarium use, and made it her aim to become an activist against sunbed use upon learning she was terminally ill with melanoma. The Slip Slop Slap campaign informs the public about the dangers of too much sun exposure, yet does not do the same for other dangerous methods of getting a tan. While the Slip Slop Slap campaign has admittedly done some good work with regard to safety in the sun, there are aspects that could make it much more successful in the education of the public. Many of the flaws in the campaign come from its delivery to certain population groups and specificity of its message. While education is being provided, more work needs to go into target audience, and the way it is delivered could be modified. Emotive shock campaigns like those used by TAC for road trauma could be more effective to help Australians be safer within the sun. Until these deficiencies in the Slip Slop Slap program are addressed, it surely cannot be considered an effective program.